So we'll call the meeting to order. And, we'll do the roll call. Rep Burnham. Here. Rep DeRoy. Here. Miles England.
Here.
Your location and.
Oh, you're supposed to say, are you alone in the room? And
Right.
why you're not here?
I am in Rollinsford, New Hampshire, alone. I am sandwiched between meetings, so I didn't have time to travel to the courthouse.
Thank you.
Okay, thank you. Rep Howland.
Oh, here. Sorry.
Rep Kaczynski.
I don't see how.
Yes, Rep LaMontagne is here. Rep La Rochelle.
Present.
Rep Potenza, I understand is on her way. And Rep Waller is here. Okay. We have a motion to approve the minutes.
So move.
Second.
All in favor?
Aye.
Aye.
1, 2, 3, 4, 5, 6, 7. Is that right? 7, 0.
So I sent everyone the draft committee report of what we have learned so far and what our ideas are for the future. And I thought we might discuss that. Has everyone had a chance to read that?
Not after the last 3 days.
Oh, okay, well,
Midnight budget meetings, so
Yeah.
no.
okay. Well, I will go over some of it. And you do have a copy of it here. The background is basically summarizing information that we had gathered here in the committee about the history of the county farm, which eventually became the nursing home. A review of the status of what private nursing homes can and do provide, and some of the limitations about that as far as covering Medicaid residents. And reviewing the current status of the Riverside Rest Home, what our occupancy is, the waiting list, our specialized units that we provide, and also the care level needs of the residents, becoming much higher than they have been historically. And also a review of the facility issues at Riverside Rest Home. One of the few nursing homes, county nursing homes in the state that still has, no private rooms and all shared rooms with 2 adjoining rooms of 2 people sharing 1 toilet. The heating, electrical, and plumbing systems are all very old and require major repairs. We have asbestos in the building, which makes renovation work really complicated and nearly impossible to do while the buildings are in use. And also with the more obese residents that require a lot of special equipment and wider equipment, the building was not designed for that, which creates also a lot of restrictions and limitations on the facility. And that we also don't have a skilled nursing unit, which we miss out on revenue because of that. And also reviewing what are other resources for long-term care or supportive housing for seniors. We did spend some time as a committee doing that. You know, more or less, we provide over a third of the nursing home beds in the county. When you look at how many private nursing home beds are. But there is a moratorium on new nursing home beds in the state, both public and private. So we're not likely to see more nursing homes built, right? We're not gonna see that, and actually nursing homes have been closing. In the state. But also assisted living facilities are another, option. And there are 21 in Strafford County. And about half of them do take, choices for independent funding, which is Medicaid, but for assisted living. Basically. Does anyone have any questions about that, understanding what choices for independence is? Because it can be used for providing support for people in their own home or an assisted living facility. And there are other housing options for seniors. But that's not the same thing as a nursing. That's not assisted living either. You know, housing options for seniors provided by the city of Dover, or Rochester, Somersworth, or nonprofits like Covered Bridge. All of those rely on the voucher system in order to help subsidize that housing. And the waiting list for a voucher is 3 to 5 years. And that's not likely to get better. Okay, now here's where a lot of controversy. What are our estimates of needs for the future? Strafford County does have an aging population, as does the state of New Hampshire at large. The population of Strafford County residents over the age of 85 will triple in the next 25 years. In 2025, residents 60 plus outnumbered the number of children in New Hampshire. So making us one of 11 such states in which that's the case. And the estimated number of people who will need a nursing home bed is expected to increase by around 200 plus in the next 25 years. And this is based on Health and Human Services Planning and Review Board formulas. And some have argued that the need for nursing home beds can be offset with more assisted living beds, but that's only for a lower level of care. And private assisted living facilities are too expensive for most New Hampshire residents to afford. And it has been argued that the new GLP-1 weight loss medication will decrease the population that will need nursing homes in the future. But these drugs are so new that we don't know the long-term impacts of taking them. Right, they may reduce obesity, which may make our bariatric population in nursing home less. But we don't know that it's going to reduce risk for dementia or psychosis or any other chronic condition. And also, these medications are really expensive. And Medicaid won't pay for them. And Medicare won't pay for them unless you have other conditions that they would justify that. So again, it's one of those benefits that if you don't have resources, you're not going to benefit from that. Feel free to interrupt with me at any point. Yes?
I was going to interrupt you to ask whether I could interrupt you, so. So I hesitated to do that because I didn't want to interrupt your full
Yeah.
thought. But I have a couple of comments. So I heard something on the internet just a couple of days ago, maybe some of you heard it as well, that there's a new discovery. It's not something wild. There's plenty of wild stuff on the internet, that's not accurate, but this is spoken to by some people with good reputations anyway, reputations to be sure. Indicating that there are some new, scientific discoveries with regard to dementia that seem to suggest that there's a possibility to reverse, because what I've been hearing for years is you get to a point and you know, you're gonna keep going if nothing is done, you're gonna get worse and worse and worse. There's some indications that you could, that some treatments will stop you where you are and you won't get worse. But this suggests that you can actually overcome the dementia and get back to functionality. I mean, it had a whole bunch of people saying, you know, I was basically a vegetable, or my husband, my spouse was you know, completely non-functional, not the person I knew and had been married to for X number of years and so forth. And this new treatment restored them to, so they were themselves again. So I'm wondering whether the staff has any awareness of that, because to the degree that this information actually becomes widespread and is borne out by other, corroborated by other investigators and so forth, that would certainly be a godsend, literally, for all of us, not to have that horrible fear. I am almost 90 years old. My brain is still working, but I'm wondering, you know, and I'm sure we all wonder when the day will come when we start going off the edge of the cliff. Well, if this new procedure is actually successful and becomes widespread, maybe we'll all be able to go to eventually to our grave with our brain saying, I'm okay with going, but it's been a great ride, and not going like, oh, I have no idea what's happening.
Yeah.
Because I remember what my mother was like at 91. You just sat there like a zombie. And
Yeah.
what kind of a life is that? But
But we-
it's in terms of our procedure, the reason I'm raising this is because if George's projections are accurate, and that's what we have to go on at the moment, we're faced with enormously increasing
again,
numbers of people.
That's just, dementia's just one of the reasons you
Just
end up
one.
in a nursing home.
Absolutely.
My mother's mind is still fine.
Yeah, and
She
we know
can't walk
people-
anymore.
no,
You know,
no.
there are a variety of reasons
Same,
why
right.
people,
But
end
these
up
are
there,
all
but I don't wanna
aspects
get
that play
too-
into what we're talking about here.
yeah. Okay, so I'll go over some other related issues that we need to think about, that inadequate nursing home or assisted living beds are a major barrier to hospital discharge. Costing New Hampshire hospitals millions of dollars a year. You know, we have the waiting list at Riverside Rest Home, which is, you know, the last resort, but for many, it's the only resort for many. And HUD cut funds for new assisted living facilities that would accept choices for independent, choices for independence funding, which would, you know, help the nonprofit or private sector build more nursing home beds and be able to take these residents. And the state is underfunding Medicaid. Facilities are reimbursed 28 to 31% less than the actual cost of the care, passing costs on to county taxpayers. Or in the private sector, they can only take Medicaid residents if they have enough private paying residents that can cover that cost. And then there are other big bill that passed last year in Washington made several changes that will also negatively impact revenue. Specifically, the retroactive billing period was reduced from 6 to 3 months. So it takes a long time for many Medicaid applications to be processed. So, you know, often they started the application before they're in nursing home, but by the time it actually is approved, you're providing care for free. And if it's over 3 months, then you're never gonna get paid back for that. So, a lot of what I worked on with help from others is looking at what other counties in the state are doing. For some counties, I only have an information I could get, online, and other counties I was able to have really in-depth conversations with the nursing home administrator and the county administrator. And also talked with, the leader of the nursing home committee of the New Hampshire Association of Counties, Craig Labor. So, I mean, his general advice was, keep all design aspects functional with staff efficiency in mind. I think that is something we can all agree upon. And that he expects that there will be more private nursing home closures in the near future. And I kind of looked at like what the size was of, how many beds each county's licensed for compared to the population, and it does vary a little bit. I was kind of surprised. Okay, Carroll County, many of us are, so Belknap County, I didn't have really any more information about that. Carroll County, many of us are familiar with that because we went on a tour of the facility. And, they built a new nursing home, 15 years ago. And read all of this, but that's, I think, the only county nursing home that was built with, around the green, I forget what the other terms are, but it's with, this greenhouse design with these pods of 10 residents in a cluster. Which is lovely, sorry. But also, really does seem to have higher staffing needs. I would still like to get, for each county to kind of break down what their staffing costs are per resident. Of course, we only have that one model at the county facility. And actually, last year, I visited, a private, nursing home greenhouse model down in Massachusetts. And, again, it was, a nice facility, and, they all had private rooms, which were lovely, but, it was expensive. And it did sort of strike me at, Carroll County that going into that pod, we didn't actually see residents hanging out in the pod. They're in their rooms. So I sort of question how much that community is possible when you get to a nursing home level. So and then the renovating of the old nursing home, and this is an ongoing thing in Carroll County, that they're using parts of the old building, some for assisted living, some for other county functions. And they did get some of the ARPA money. Cheshire County, I had a long conversation with staff from there. And they built 20 assisted living studio apartments, in 1998, so a while ago. And, they're licensed for 40 people. Because you could have some couples in there. And they did a major construction of a new nursing home addition. For $38 million. And most of the construction took place in the pandemic, which in some ways made things easier because their census was down, as for almost all the facilities at that time. But they were able to build a new unit, move people in there as they renovated other units one by one. They also had asbestos, but were able to manage that with isolation. And the units were completely gutted, which regarding the asbestos, I think it can depend where the asbestos is. If it's just in the flooring, that's easier to take it up and get rid of it. My understanding that at Riverside, it's in every wall itself. But that's something that we will have to look at in detail. One thing I think that they did, which was interesting, is they had a task force about this that included members of the public, not just of the county delegation or the administration, but to try to put together a broad county to develop the plan for the nursing home or assisted living beds. Okay. And, this project though was, mainly built with, by taking out a bond. They had a small amount of ARPA money and gopher money, and rebates from Eversource. But interestingly, they ended up changing the contractor right before construction started or in the very early stages because they were projecting to run over, and they were able to, just renegotiate another contract with a different builder who was gonna stick with the budget that they had. Okay, so not much information about Coos County, Grafton County. Again, they did a renovation 20 years ago. And they did have, they have a small number of private rooms and the rest are semi-private. Semi-private, many of them that have gone this route have, done so by creating what they call a 3/4 wall. So the bedroom areas are like in an alcove, but no door there. And then they share a bathroom with sort of a common entrance, which does save money, saving, by just having one bathroom that's shared. Let's see. Merrimack County, some of us toured that facility, which is an older facility, but they are now, going through a major project where they're converting, the old nursing home, I think, into, or a couple units of the old nursing home into more assisted living beds. And, Rockingham County, they've, operated an assisted living facility as well as a nursing home for over 20 years. And then Strafford County.
Can I ask a question? How many beds for Rockingham?
Do I have that on there? I do not know. I probably have it in some of my notes, but forgot to add them here. Thank you. And, Sullivan County, they are just finishing up a multi-phase project there. And I did have a conversation, with people from Strafford County, in which they built a big new addition, tore down one old building, and then renovating, the other facilities. Actually, they built, connected two new single-story additions, I believe. And they have had a complex funding structure, but this total project was $75 million. So that's a big issue. We can't look at housing costs that were 10, 15 years ago. The most recent housing costs, everything costs so much more. I mean, we've seen that cumulative effect of inflation and labor shortages are some of the biggest factors going into that. And they're not likely to come down. they've, integrated a skilled nursing unit into the plans. Some other things they did to actually save money was to use modular building techniques. And, oh yeah, and just as a side note, because I did talk about, with the county Association of Counties, nursing home, coordinator, committee leader, that, Sullivan County did go the privatization route and contracted with Genesis. And it did end up costing them more money. They were losing more money going further in the red than they had been running it on their own. And they did not renew that contract.
The only thing I would add on the Sullivan County, even though the project was $75 million, that was the sticker of it. The actual bond was only 35 million. The rest was paid off by FERPA. So it was like, I think it was 42% of the overall project came
Wow.
from state and federal money, which is a great deal.
I wish we had that. Any, comments on, because all this basically reviewing information gleaned so far. Anyone have,
Other than the
comment about-
fact that it was state and federal money, which is still our money. It's still taxpayer money. So we're still paying for it no matter what.
It is,
where
but
comes from.
the difference is that, that fund how you get that money is different. So, what the difficulty is right now is we're gonna rely solely on property tax. So, if you use other revenue streams, you don't concentrate it down on property tax, which disproportionately hits homeowners, which is one of the big complaints we're hearing.
yeah,
I think one of the things we all need to keep in mind as we look at this material, and thank you for doing such a thorough job, is that counties have different sizes, different volumes of elderly and people in need of nursing home care. And so when we look at this, we have to keep also in mind the fact that renovations are quite different from a new building. A new building requires soil studies, connections to sewer and water, landscaping, all kinds of other things. So this is excellent, but we need to keep in mind what our individual needs are here in Strafford County. Thank you.
yeah. Any other comments? Questions? Okay. So I started like piecing together a vision of how we might move forward. I think it's clear we need to have updated facilities where, only Grafton and Coax counties have also not significantly improved their nursing homes since they were built in the early 70s. And I don't think any of us would disagree that Riverside Rest Home is in need of major upgrade. Okay, and I think the question is, can we still use part of that facility by renovating it? Or just, the several counties have built a new addition and then reworked some of the older buildings. Some have made assisted living beds. I really think that's a direction that the county should go in. I think there are, and I'm not sure, but we have some people who have really high physical needs that definitely need to be in a nursing home. Some, could you operate an assisted living dementia unit that is not, perhaps could have lower overhead, but just to address that need, and could that be in a separate building? It could be that it is just too expensive to consider renovating Riverside, given the asbestos problem. We just need to tear it down. But if we could find a way to repurpose that as assisted living beds, that could be a great benefit to the county, and just build the new nursing home to be the new skilled nursing facility. and lower levels of care could be provided at lower cost. Right, because yeah,
Lower cost.
assisted, yeah,
The budget for Riverside's going up the last several years, $2 million a year. One year was about 5 million.
right, but what
But
I'm,
you're looking to increase the size of this operation quite a bit by what you're talking about.
no, but what I'm saying is an assisted living facility could be, operated at a lower cost because they have different staffing and physical requirements than a nursing home facility. Like the county has done different, and then the assisted living facility could, possibly be open to private pay. Right, it could be a combination of choices for independence and private pay.
Are you saying this could be run cheaper than a private facility?
I think it possibly could. I mean, if you look at Sullivan County. Well, and
Well, I'd like to see the figures on that because I spoke to somebody recently as a relative in a private facility, and it seems like, what I'm seeing for the cost of per day is quite a bit more in the county facility. So by increasing the whole operation, I'm seeing all the costs that, I mean, you're talking pensioned employees, high benefit packages. That's in relation to the private sector here. I'm leery about increasing the size of this
I don't
operation.
think necessarily it is increasing this, to play the devil's advocate, you're reallocating your resources, I think is what she's saying. So in other words, if the total population remained the same, but you were able to divert a large part of that population into assisted living versus nursing care, where the assisted living is a lower cost, the overall aggregate cost theoretically would be lower, and that's what she's saying.
But you're
So,
putting in another building,
well, again,
two buildings.
you need two buildings, so in theory, you would have a smaller nursing section and a larger assisted living section, so that the aggregate cost would be lower than having a larger nursing care. That's theoretical.
yes. Right. But in general, private nursing homes are very expensive, right? It's, sure,
I'm dealing with a relative in one, and it's kind of enlightening to see some of what's really goes on and what we were told on this facility. It isn't all that different, as far as a number of different issues. It's kind of enlightening, and talking to administrator there that they're actually fighting for the same patients as you're talking about here, so it's
Yeah.
interesting.
well, but I think what we have learned though is that a resident who has extremely high needs, they will send to the county nursing home. If it's too expensive for them to take care of them, they will send them to Riverside. So I think it's hard to just say, compare apples and oranges, and so.
Okay, so, we heard just relatively recently, George, is it not the case that we're spending something like $1 million a year in, maintenance costs? We could call them maintenance costs, but it's more than maintenance. Vital reconstruction such as the sewer line to keep Riverside going. Would that cost not go down dramatically in a new building? And to the degree that we would repurpose Riverside, it would not be for nursing people.
Not for nursing home.
No, it's not sooner, that's the argument that we've heard over and over and over again, which I subscribe to, that this current nursing home would not be accepted by the feds. It's grandfathered because it's been here for 50 years, but the new requirements, a single bed, single room, maintenance and a bathroom in each room, not what we currently have. So the repurposing of Riverside would be for other people, such as people who are unhoused at the moment or who are being forced out of Strafford County by rental costs. They want to stay here in Strafford County, but there's no place that they can afford. If we were housing those people, they wouldn't be paying nothing. Right?
The adaptive use of Riverside would have to be something depending on nature.
But wouldn't it become a revenue source if we were renting to people who want to stay but cannot afford $1,500 or $2,000 a month in rent?
That's true. That's certainly a possibility, if you're
Right.
gonna make some kind of workforce housing.
And if we got out from underneath $1 million a year to keep Strafford, to keep Riverside going.
The codes, what kills you is the code of the compliance, which we've been trying to meet over the course of time. It's expensive in an old building. It usually drives up your costs simply because the way Riverside was constructed, and all the walls in Riverside have asbestos, concrete in them. That's the way they built things in the 70s. So every wall in petition has asbestos in it. So you either leave it alone or you can take like Sullivan County had some asbestos walls of that nature in their project. To remediate the walls was every 10 by 10 square foot wall section was around $15,000 to remediate. You take it out and, replace it or not replace it. What they basically did was take the wall down between two rooms and make a single room. Now, that sounds easy. However, it depends whether those walls are load walls or not. I carry the load of the roof. In Riverside's case, when they built it on the cheap. I know I was here, and what they did, not that I was on the committee, but I remember when we built it, and what they did was they built a ton of carrying walls and then put a stick roof over the top of it. Okay, so a lot of those walls are load bearing. Now that doesn't mean you can't put a header in. Okay, put a header in and then take the wall out from underneath it. You could probably do some of that kind of stuff. But in Sullivan's County's case, it was 15 grand for a 10 by 10 panel. I found that information out. Merrimack County is trying to convert their old nursing home to 80 beds of assisted living. Merrimack, but that building was designed differently. It had steel support in it. The interior walls were not load bearing walls. There's a lot of dynamics to each individual construction. It's not an apples to apples comparison because the construction of what they've done was based on what was available at the time. And, they put things out to bid. If you think about it, they put things out to bid and there's multiple ways to build a building. Okay. And so they're not all the same. It's not a cookie cutter deal. So you have to look at your individual situation. Like Representative Wall pointed out, not only individual populations in your region, but you have to look at the actual infrastructure of Riverside, how it's constructed, as to whether or not we can do some of those things. I'm not saying it can't be done. And depends on the use that you want in the end. Because every time you change that use, you have a different set of codes. Now, Riverside has almost the same code as hospitals. So whatever you build, you have to meet that code, which is, there's no question it's expensive. It just is.
Yeah.
It's the nature of it.
Yeah.
Thank you, please.
Thank you.
Yes.
I understand the whole asbestos thing. We've known about that for a long time.
Yeah.
And that excuse is out the window. Maintenance for that should have been taken care of a long time ago. I end on that. shared bedrooms.
Could you elaborate on how it would be possible to take care of asbestos? What's so running?
It's like you said, you can do one section at a time, but
What do you-
that is at that time. I'm not a construction person, but people do this all the time. We see this in schools, old buildings,
Yeah.
they reconstruct sections at a time. That should have been done a while ago, but we didn't do anything. We didn't do piping, we didn't do, all that was just all an emergency situation, cost more money. And instead of having proper maintenance planning, like we do when we know our 25-year-old roof is going to go, we think about that at 20 years, so we can maybe even 15, so you could save to fix it. These are the things that those excuses go away a long time ago. Because now it's just like, break it down, let's build something new. And it's very costly, yes, and now there's new codes, yes, I get that. But the whole like idea of shared, this is out of experience for shared bedrooms. There's nothing wrong with shared bedrooms. My mother lives in a shared bedroom with one toilet. And you know what? She's not on the toilet all day. It's okay to share a toilet. We share it at home, don't we? And she likes having a companion in her room. You can have an option if you want to be by yourself. There's options for that too. And you can charge more money for that room. Okay, my mother's place does not cost over $500 a day. It's actually over $100 cheaper. And it's a private facility and they accept Medicaid. So those reasonings are not the reasonings. We have to stay focused on the taxpayers and what they can afford. We're already paying Medicaid. We're already taking care of people. Okay, my heart goes out to those who don't plan ahead. When you're in your 50s, start planning, because guess what? We're all going to go somewhere. Whether we live our life to the fullest at 90 or we're 60 and we have a major hemorrhage or a whatever, what do you call those? This just happened to my sister-in-law. I'm gonna have it right now. It's a
Memory loss.
Memory loss. I can't think of the word, but things happen. So you have to try preparing. That is your sole responsibility, is taking care of your vessel. Whether you decide to feed it too much and you're 700 pounds, or you don't feed it enough and you're 100 pounds. That is your sole responsibility. Our responsibility is for the taxpayers. And how much are they going to bleed out to take care of people that are not taking care of themselves? And this is where I'm at. You know, I feel bad my mom's in a nursing home. I tried to keep her home. Many people will do that until they can't walk, until they need two people to assist them to a bathroom. These things happen. You plan accordingly. You have things, you have your home, and you try to do your best to pay for those things. To go ahead and upgrade and make taxpayers pay for that is not fair and responsible. Not to us. I'm sorry, I'm sitting here and I know reality. I'm in it. I wasn't in it 2 years ago. I had a different response, but there are many private nursing homes today. We didn't have that when the county or the towns or the cities took care of the people, the indigenous. We have that today. We have a lot of that today. There's a lot of empty rooms in the private facilities. They're all trying to get some kind of rotations in there, and they're short-staffed. So I don't see that we need to be that business of expanding and providing more when it's costing people more money. I don't see it. I'm sorry, but
Why do you
some of
think
these
there are,
excuses I just don't see as as reasonable.
why do you think there are empty beds in private nursing homes and we have a waiting list?
I don't know if you have a waiting list, to be quite honest.
Numbers.
We do have a waiting list.
Okay, so, but is that waiting list all Strafford County people?
Is it because you have less staffing? Isn't that the reason, right? We're not really facilitating all the bedrooms? Is that true? Isn't that the
In
case?
2004, we took in, 35 people from out of state. We took in 38 from Rockingham County. Are these Strafford County
When we
people?
do take people from other counties, we're reimbursed from that county.
Doesn't
And
matter.
one
That
of the
doesn't hit the bottom line. That doesn't hit the bottom line. It's not hitting the bottom line.
Medicaid,
Right,
Medicaid and Medicare is a federal health insurance.
I understand that, I know that.
Yes, but the
And they're
state also
allowed-
pays for half of that too,
Yeah,
which we are
exactly.
paying.
I know, they're allowed to migrate
I
throughout the system from state to state. Normally, we would take somebody if they had family here. That's how people come here from somewhere else.
I know.
If that's, I mean, but they're allowed to have that. It's a right to take that. It's got nothing to do with whether.
Well, it does have everything to do with if we continue to have a budget increase, year over year. And right now you're proposing $39 million for Riverside Rest Home. So can we get on to more stuff or my stuff, or are we gonna?
You conclude?
We will, I would like to, let, Representative Howard speak, but I just do want to clarify that we, in addition to receiving Medicaid, we are reimbursed for the county share from the sending county. So it does not, we're not subsidizing other counties if we accept people from other counties. And, you know, it could be because we have the specialized.
Okay, so
psych
if
unit.
we paid $30 million for Riverside Rest Home 3 years ago, okay? And our numbers haven't really changed, they haven't gone up, okay? And then now the budget is gonna go up like whatever, 5 million. I'm just using numbers here. So if we paid 30 million 3 years ago, and now the budget is 35 million, and we're getting however amount of people from another county. So we're paying more, the cost per patient, the cost per resident is through the roof. That you're saying there's no, yes, there is, because that county is not paying the Strafford County taxpayer. We're not getting made up for that. So if you're telling me that it would decrease in the cost of the budget, fantastic. So take out those 53 people, take out those 90 people, whatever it may be. So then their county can pay that liability.
They do.
They, as I said, they already have, I think,
Okay, sure.
each individual, that's sort of budget neutral. But, Reverend Collins?
So one thing I want to throw in a couple of just, I don't want to like relitigate the sins of the past. I think anybody who's worked in local government can tell you horror stories of deferred capital improvement. It's really common. And it's really common, particularly when you begin to look, you know, it's timely that we're going to start our budget, because what happens is many municipalities make the mistake that they defer capital improvement to try to come under a certain level, particularly if you've done a tax cap. And what you discover over time is that you never can make up deferred capital improvement. You can't, it never gets cheaper. We were lucky actually for a little window there because we had ARPA money that flooded in over the last few years. And by the way, the state never did pay that, they just passed it right down. And now that the ARPA money is gone, the state hasn't made up the difference. And so that window has closed in terms of incentives. So it's a danger that all over the state you can find. And it doesn't do you any good when you look forward. I think what really for us is like, please don't fall into that trap of deferred capital improvement so that we aren't having this discussion. Second thing about like personal responsibility, actually, that is kind of the push I had in here, which is like state law. So if somebody actually doesn't have any money, you don't just say, I'm sorry, that's your personal responsibility. Actually, that's where the law comes into effect in terms of the welfare office, and that becomes our obligation. So regardless, it would be great if everybody planned well. Unfortunately, not everybody plans well and circumstances happen. So I think one of the big pushes I made in terms of this report is that we have a clear understanding is irrespective of what people have planned in their life, what is the county's obligation, because we're going to pay this money no matter what. And so I just wanted to clarify that. I think in terms as we, kind of bogging down, I just wanted to move us forward because I did have that section on bonding, because a lot of that's going to come up, whether we repurpose or build or whatever the heck we do. I just want to make sure we get up on that.
I just want to be clear that throughout this process, since May of 2022, we have never been offered the option of a renovation. Never.
Right.
There's always been a focus on a new building, expensive building. We heard the reasoning from one side that might be, have a little interest in this. But we never, ever got it doesn't pay, it's just, but we never got any kind of proposal. In every other county, it appears what they did was renovations.
Good news.
As
In
opposed-
part, just about every other county has built a new addition and renovated part that they could. But one of the things in my proposal is that the first thing we do is take a look at that question with both try to use some of the assessments that were done already, but have a different firm, take a look at those, take a look at the buildings and see what is feasible to repurpose if it's not repurposed for nursing home beds. I do think we should look at, I hate to tear down things that could be reused, right? But it doesn't look to me like making new nursing home beds in that building is feasible. But could we make them into assisted living units that there's a huge demand for them, need for them? But yeah,
Can I ask what the difference would be?
between assisted living,
Right, if it's not feasible for a nursing home, but it's feasible for assisted living.
okay, well, for one, nursing home beds, every county now, when they're building new, they are having to build for bed lifts, not for every unit, like, I think it might be 25% that need to have structural support in the ceilings, they need wider, space to get equipment in and out. An assisted living bed could have like a normal sized room. It could, and a lot of it is staffing levels. Like you need to hire a person that needs 2 people to help them with every activity of daily living. That unit is gonna need more staffing than a place where they just need to be held in a secure place where they're not gonna wander out the door. So they can be simpler to operate.
I guess, I'm sorry to interrupt, but the problem is that there's this asbestos in every single wall. So my question is, what's the difference between nursing and when we just leave that there for the assisted living people?
It's a matter of whether it's sealed up or not. You can't, you remove what you can, but some of it, or it's sealed up and not, right? Like if you can gut the whole thing and get rid of the asbestos.
You don't necessarily need to do that. Like that's one little tiny area that I have a little bit of expertise in. Most of the time, all of the very, very expensive projects are when you have to like tear down and of course with ventilation and all that kind of stuff out of walls. If it's in the floors, it's much easier. It's exactly right. They seal it. So, and you can do the same exact thing with walls. We have come a very, very, very long way. Many companies for a very long time posed people for in that space. And so I know it well. We actually worked on a project, my husband and I, so I know it extremely, extremely well. So, and I know companies that do it and all of that. So it's not, if you don't have to disturb it and it's completely sealed and sanctioned up, you're fine. It can stay there. But yeah, when you're tearing down walls and doing things like that, yeah, you have to remove it at that point.
But
Most
even
of the time you can seal it up.
if we were going to completely, have to get in there and deal with the asbestos one way or another, right? It's gonna be disturbed. And if we got a unit, we have to bring it up to current standards, right? We repurpose it or even convert it and update it. And we're looking at if we convert all of these rooms to single unit. And these are small rooms. I was a little shocked how small they are. Like they seem like really 2 people in this room. I can see it working if one person, but even if we were able to do that to every bed, every room, then we'd have half the number of beds, right, at Riverside, if we don't build anything new.
You got a question?
Yes.
Thank you. For a while, graduated care facilities were a big trend. And now we have more assisted living places. But at a certain time in life, a lot of people get to a point where they just can't even deal with assisted living at whatever level that may be and have to go into a nursing home. And our charge is to figure out how we're going to deal with the people who are the neediest, the most unhealthy, the ones who really, really deserve and need to live in a nursing home. And we can't just talk about what we want or what we believe a place should look like. We have to go with federal requirements. And the feds require certain size rooms, windows for each bed and certain things like that. So this committee has a charge to figure out, and it would come a certain distance, and I thank you and thank everyone for coming this far. But what we need to do is accept this report and then determine where we're gonna go from here. Because we do need a nursing home. We've lost out on a major, major gift of the ARPA money. And now we're gonna get slammed with responsibilities of paying for this. So we've got to figure out what are the absolute needs that we have to have and meet. And how are we going to deal with the population of the kind of people we have at Riverside now? Because no matter how you plan in life, things happen. And you can be very wealthy and all of a sudden the rug can be pulled out from under you because of an accident or an illness or some tragedy. And you never know how any of us are going to end up at the end of our lives. So I'm at a point where I want to figure out what the feds are requiring, figure out the size of the nursing home we need. I have a problem going with fewer than the size we have now. We have 215 beds. My concern has been all along, if we drop down to 170, by the time this gets built, it's gonna be too small. So, because we know the population for the elderly is increasing, so that's where I stand.
Yeah, right.
I just, so we don't bog down just a process thing. My hope would be, before we litigate each idea, let's just throw all the ideas down.
Okay.
I think the biggest, I mean, we're gonna come up, we're gonna have, my hope would be that, and that when we present this to the delegation, we're gonna have a list of ideas. Well, we have the background already, but we're gonna have a list of ideas. I think all ideas, I think it's a good idea to have all ideas sitting out there. I think it's very likely after we present this to the delegation, then we'll begin to vet the ideas and see which one are possible. But if we sit here and we bog down and do the vetting of the ideas right now, we will be here forever. Let's just get the ideas on paper. I know Kelly has an idea as well. Let's get them all down
Alright.
there. And
I would like
go.
to, yeah, I can quickly finish up with some of the ideas that I put forward. And that, I think it's terrible that we missed out on ARPA money. Other counties took advantage of that. We have the Rural Health Transformation Project money that's out there. Could we look at, doing something with that? And if I think we have 2 assisted living facilities in the northern part of the county, the more rural part of the county. There's a need for assisted living beds. Could we apply for money to purchase those and have a public-private partnership where we contract with a nonprofit that will open those as and accept Choices for Independence funding for that? I think that would help a lot, right? If we can have more assisted living beds that are affordable, that could address a need. So I would really like to see if we could move forward with that. And then we still have, we had authorized the bond for $6 million. We still have $4 million left that we could use to, as I said before, reassess, could Riverside be renovated in some capacity? And then, and then also like reassess the land use that we have in the county. Could we consider plans to offer some of the county land to a private company that might build some assisted living facility on it. I think you know, we would have to be guaranteed that they will, accept choices for independence funding, right? It's clearly, okay. And, okay. That's basically the most of the ideas that we put forward in that, and maybe we'd like to hear from, Rep. Tenza on her ideas.
They're not my ideas, so I want that to be crystal clear. None of these are my ideas. I took data. I didn't do, none of this is from me or what I want or any of those types of things. In a perfect world, yeah, let's have a brand new building, let's have all these great things with unlimited resources, but we don't live in that world. And I have to say that this project is, has been unbelievably, eye-opening and upsetting, to be honest. And there's people that I think are upset because, I was kind of living and breathing this, reading, researching, gathering data, all of that kind of stuff, talking to multiple people, that are truly experts in this field, because I am not. And I'm not a finance expert or any of those types of things, but I know basic math. And basic math is, and before I get into reading some things that I want to read, this is where, hold on, I'm gonna get to it. Cause I'm working off of a summary that you guys all have. And then the main draft report, which right now is like 24 pages long. So, which has lots more data. Okay. So if you just look at budgets and we just look at straight numbers, in 2021, we paid per resident, per patient, $201,000, $201,368. In 2022, this is every year, $193,919. 2023, $209,432 per person per year. 2024, $208,272. 2025, $220,000. And now we're proposing to pay $231,000 per person per year. That is literal insanity. So basically, while the exact 2024 figures right now aren't fully released for the latest like reliable data when it comes to the US Census, which is basically when we're talking about Strafford County's medium household income. So what I do have is from 2019 to 2023, which is pretty accurate. So that's household income median in Strafford County is $86,564. I'm telling you, I don't care where it comes from, whether you have an R by your name or a D, none of that matters here at all. If you pick up the phone and you call anyone, and I talked to somebody for a very, very long time yesterday in Rochester on the other side of the aisle, and I just told her this, she was floored. I mean, she's on a fixed income. She makes about $46,000 a year. And to realize that she's paying, her taxes are paying for one person here in the county, $220,000. That's insane. That's absolutely insane. I mean, it's just physically crazy and irresponsible. So, and then if you look at what's a single person's income? So let's take that. So if we did, let's say that we will pay, the county will pay, the taxpayers will pay for the indigent, whatever you want to call it. Let's say 50 grand, okay? $50,000 we will pay per year to help these folks, right? Let's times it by 170. That's $8,500,000, okay? And they're asking for a budget of, what is it? 39. It's simple math. How has anybody not done this math?
True.
And shame on me. Because, you know, I came in 23, you know, this whole argument was all ongoing. Fighting in 2022, we came in, we had no idea, kind of thrown into it, a lot of misinformation and stuff going around. And, you know, shame on us, shame on all these people for all these years that, you know, I was really mad about the conditions in the nursing home, mainly for like with the air conditioning, the heating and the ventilation, like drove me crazy. I'm like, this is stuff that should have been done a long time ago. Nobody in there should be suffering. That's ridiculous. So, and nobody wants that. But we, the data is clear. So right here, right on the top, based on decades of utilization data, independent research, and sustained taxpayer burden, the evidence supports one conclusion. Strafford County should not be in the nursing home business. That's it. Continued or renewed county ownership would require significant long-term capital investment and liability despite declined demand and the availability of multiple private and nonprofit skilled nursing facilities already serving county residents. The remaining policy question is how best to reduce exposure while protecting current residents, not whether continued county ownership is justified. And so I'm also going to read to you, because New Hampshire is really kind of a unicorn when it comes to this. And I didn't realize this until I did my own research. So I'm going to read you a paragraph, and this is going to be from the report as well, which tells you about what's going on in New England. Hold on. Gosh, too bad it's sorry, it's a long document. There we go. Okay, so New England comparison, county nursing homes are not the norm. So unlike most of New England, New Hampshire maintains county operated nursing homes. Neighboring states such as Maine, Vermont, Massachusetts, Connecticut, and Rhode Island rely almost exclusively on private and nonprofit providers for skilled nursing facility care without county ownership structures. A review of state licensing directories, Medicare certified facility listings, and county government roles in long-term care indicates that county-owned nursing homes are rare nationally and largely absent across the rest of New England. In these states, access to skilled nursing services has been maintained through a mix of nonprofit, for-profit, municipal affiliated, and faith-based providers. The continued delivery of nursing facility care in these neighboring states demonstrates that county ownership is not a necessary prerequisite for ensuring access to high-quality skilled nursing services. Instead, oversight, regulation, reimbursement policy, and market capacity, rather than ownership, are the primary determinants of resident access and quality outcomes. This regional comparison further supports the conclusion that Strafford County residents can be safely and appropriately served through existing private and nonprofit nursing facilities, and that continued operation of a county-owned nursing home is a policy choice rather than an operational necessity. That's key. And none of these things are my opinion. This is all from data, and I'll give you my bibliography, and specifically from the county's own numbers. References for this comparison include the state facility licensing list, CMS Medicare care compare data, and the national analyses of county involvement in long-term care published by the National Association of Counties. So let me just read this, because this is a little bit more here. So Strafford County operates Riverside Restaurant, right? A county-owned Medicare and Medicaid certified skilled nursing facility with a licensed capacity of approximately 215 beds. In recent public discussion, the county has heard repeated references to a so-called silver tsunami, suggesting an unavoidable surge in nursing home demand that will require continued or expanded county operation. The best available evidence points in the opposite direction. Utilization trends and public policy are shifting decisively away from institutional nursing facility care and toward home and community-based services, which is called HCBS. That's the lots of.
Pick, okay, we know about it.
We know about it, right? So, lots of acronyms in here. The shift reflects consumer preference, workforce realities, and state and federal policy initiatives. New Hampshire's long-term services and supports, which is LTSS, policy direction explicitly emphasizes increasing the share of older adults and people with disabilities receiving care in home and community-based settings rather than in nursing facilities. State planning documents and Medicaid policy initiatives consistently, this is over years now, prioritize HCBS expansion as both a cost-effective and person-centered approach. Independent analyses of New Hampshire LTSS trends documented a sustained decline in nursing facility occupancy in recent years. Reported statewide nursing home occupancy fell from approximately 86% in late 2019 to roughly 76% by November 2021. I know COVID, I'm not done. Mirroring the national declines during the same period. Interviews and market analysis further confirm that consumer preference strongly favors remaining at home, of course, we all know that, or community-based settings whenever feasible. These trends are not temporary anomalies. They align with the national utilization data, post-COVID structural changes in care delivery, and New Hampshire's stated policy directions. As a result, claims that Strafford County must maintain a county-owned nursing home to prepare for a future surge in long-stay institutional demand are not supported by current evidence. So, as it's said in here, it talks a lot about we are already past. We are here now entering in 2026. So the numbers haven't rebounded. We're not at that point. So basically everybody's saying, oh, it's COVID. It was COVID. We're already past that. So we're now at we can't even sustain like a 170 because we have all of these other problems with staffing and shortages and all of these other things that are happening right now. So we are in what I consider the new normal. This is the new normal. Our numbers have flattened out, and they actually are decreasing in different parts of the state in the country. So if you want to talk here about key facts, right, that are just so important, because I put these up for us. Structural decline in demand. So the Riverside Rest Home fell sharply post-COVID and has not returned to pre-2019 levels. Predictable turnover. So in 2025, it's normally about 70 or so people that pass away in the nursing home. That's the norm. And based upon seeing other nursing homes of that size, that's just hearing that from Administrator Bauer, I understand that number is consistent. In 2025, the number was different here for Riverside for whatever reason. A little bit of a unicorn year. I think you guys have about 35 deaths or whatever in 2025. But normally, and in the past, I don't know how many years, it's been 70 or around 70. So that's what I used as my basis. So that predictable turnover is important because that actually creates a built-in census reduction without like displacement. Like if we're talking about taking folks and transitioning them out into a private care, and then whatever, with our different kind of options that we have on the table, you need to use that. So rising taxpayer burden. Budget increased from 27.6 million, that was in 2021, to 39.3 million proposed in 2026. Think of that. 2021, 27.6 million. And now we have less people, and we're talking, that's what's so crazy. Less people from 2018 and from 2019, and we're at 39.3 million.
Insane.
That's insane. High cost unit, approximately $530 to $575 per resident per day. Times that by 365, that gives you your numbers. No quality advantage. This is key. We have heard in this, not just in this committee, but since we've been in the delegation multiple times, we do it better. I think that our nursing home and our staff do a fantastic job. I think that they do so much more with less and all of that. That is not that at all. And I will never knock the level of work and staff that we have here. We have some rock stars. But we can't sit there and say that we're better than the private. Like, we have to stop that, because New Hampshire data shows no statistically significant difference in quality by ownership type. So, and then of course, adequate private capacity, multiple private and nonprofit SNFs operate within Strafford County. So the other piece is, I mean, the landscape. So in my report, I spend more time on like the landscape of what we have, and having personal discussions with people that are in that landscape. And I know that someone's gonna say, so I'm gonna beat you to it, when we talk about our behavioral unit, then we know those numbers on here. Those are the hardest people to take care of. I get it. There's talk maybe that there is gonna, opening up a new psych unit on the seacoast, to help more of these people, which is great. I don't believe that, Strafford County should take, the full burden of that, in not just our county, but in multiple areas of the state. It's very, very high if you look here, where we were at. So in 2018, you had average daily census was almost 15 people, 2019, 16. And in 2024, 30. Now it's more than that. So from 2025, and that's quite concerning. So if we continue to keep increasing, in our behavioral unit, that those numbers, that's gonna be a further liability to not just the county with resources and staffing, but to the taxpayer, of course. So that's something to be looked at. Yeah, and I'll go back to that in a second. So we don't have, let me go into here. Okay, so there's like 3 different options that I put on here, basically. I remember, I don't know if this was in our meeting or if this was something that we brought up, it could have been actually in the discussions that we had with, the nursing home project, which I really believe that we have to start talking about real numbers, real data, real financial impact and burden. $170 million project is truly a tax burden of like 300 million with interest rates and borrowing and all of that. We need to be clear about that.
When we get to the financial part,
Yeah,
I got the actual number.
okay. So, same thing, like if there was a $75 million, project, you're still looking at like
$5
a
million.
$5 million. Okay, so exactly. But I'm talking about, those things are what you have to look at. So when someone says, oh my gosh, we just, we took off, we were at 150 and we brought it down to 100. You can't use those numbers. You have to say, okay, what's the interest rates, the bonds, the life, all of that has to be in there. And we have to start talking real numbers, real facts.
It's called transparency.
It's
Correct.
coming. It's in the report we're seeing.
Okay. So I put an option in here of like a 32-month drawdown with a census cap. So basically, immediately, if this is taken into effect, we freeze basically on taking in new. and we start, and the drawdown happens, some of it will happen organically, of course, as people pass on. And then some of it could happen almost instantly if there was, if there was a change and they were interested in going to another facility. But, and then we immediately put a freeze on the behavioral unit, which is the biggest liability for the county. So, for example, if we were gonna do a gradual drawdown, and then we cap the nursing home at 80, for example, I would say that there shouldn't be any more than 50% of those of those residents that are of that extreme nature. And then everything changes in there. So, I mean, we can actually spend, I would say no more than $2 million over a couple budget period of actually improving that living situation in there. And, it's a bigger, of course, there's more space. There would be more space for people. Yeah. Could there be opportunity? I don't even know. Could there be an opportunity for a public-private partnership for some rooms in there that could be refurbished or whatever? That's fine. The HVAC stuff can definitely happen in there. The quality of life stuff can definitely happen in there. More spaces, little bright lights in there, definitely. I mean, I really think that it could be improved, especially if you're drawing down those numbers. And then you'd have to reduce the taxpayer liability. So I put in here 20 million. So you have a nursing home that has 80 people. Times that by, let's bring it up. Let's bring it up to 75,000 is what we're gonna say for those folks that we're gonna offer, and that's, to help. That's $6 million. So, I mean, I talked about vouchers, we talked about all of these types of things. Like I said, it wasn't all in this committee. It was during this whole discussion that we talked about, but I don't even think that is even a necessity. But it doesn't matter. However way you slice this, the numbers are insane. From a $39 million to literally supporting, even if you did, let's just say we did, we kept it at the numbers, right? 170 times $75,000 that we're gonna give to each of these people. That's $12 million. Like, it just doesn't make sense. So I have that kind of drawdown and cap and give unbelievable quality in that point, in really working in a partnership with the other 6 facilities that we have. And then, of course, there is truly a 32-month orderly phase down to closure and a 5-year structured phase out completely. So those are on here. So just so I'm clear, I know all options avoid new county nursing home construction. There is no option at all. I'm just going to be crystal clear. All of the data supports no new building, none, 0, zilch. Like, that is not anywhere even in the discussion. So I know that's on your plate. It's not anywhere in our purview based upon money, numbers, hard facts about what's going on. All rely on existing private and nonprofit capacity, and all reduce long-term taxpayer liability. So
I've got a few questions. Comparing us with other states, how do all the other New England states reimburse for Medicaid? In New Hampshire, we pay like only about 3/4 of the cost, I think even less of what it actually costs the nursing home, why it costs us so much money, because we spend more than we are reimbursed for by Medicaid. Is that true in other states?
I don't
think-
believe it's other true in other states, but it doesn't
Well,
really
this is
matter though.
something that New Hampshire legislature votes on.
Correct.
How are we gonna raise rates? And we choose to continue to fund, pay for less than it costs to actually care for people. So how then are we going to ask the private sector to take all these people that you're displacing from Riverside Rest Home? Are we gonna mandate them to take residents
No.
that they're going to lose money on?
No,
And the other question is, yeah,
and I have to stop you because you said displaced. No one would ever be displaced. So please, let's not put like any of that rhetoric out in any way, shape or
Okay,
form.
but-
No
or-
one would ever be displaced.
but
But-
we're also saying we're not going to admit them. So where are they going to go? And
That's the question as I understood it, and I'm not hearing from you.
because,
We're not talking displacement, right? We're not talking displacement. You're saying the people that we have will die off. Right? They'll die off. But these people came from somewhere, and there will be other people that we're not going to be taking in, right? They're going to be, where are they going to be going?
Okay. So I just told you what the costs are, $230,000. If I handed you $230,000 every year for your mom, is that gonna be good enough for you?
Can I just?
Like, no, this is what doesn't make any sense. We're not making any sense here.
Just like
Like,
procedurally,
if you've got,
I don't mean to
They
interrupt.
care.
I understand everything you're saying, and I'm listening to it, I'm just trying to get us on paper to keep going. So so all of this is great information, and you have 3 proposals, which we will tack on to the report, and your,
yeah, I don't want anything tacked on. I will hand you a full report.
whatever,
'cause it's got
however you want
more-
it. So
Yeah,
that-
I don't want
that-
anything
and-
tacked on. I don't want you
the
to
aggregate
take this,
report
this is
that I can
just a
hand-
summary right now. Exactly. So
So-
you'll have it completely and add on to what you guys have done.
I just don't wanna get,
Yeah.
again, I think for today, and I'm sorry to be overstepping, cause I'm just trying to keep it moving along. That we will like put this all together and we'll come back in February, there's gonna be a vetting stage for everything. I think the most important thing is actually to lay down the most ideas possible, and I think you've got 3 done, and we'll put them in there. The only reason I'm sorry to interrupt, I do think it is important to look at Medicaid, how Medicaid is paid statewide, because it's different, and it has a dramatic impact on funding, so I just am putting a little bit of.
I agree with that.
I just
There's
put a little
huge-
asterisk
yes,
there.
I agree.
to be-
There is a huge problem with that. I can't give you the answers,
But
because
we,
I
can we
just
just do
can't.
that? Well,
Yes.
I started
Yeah.
and then.
Our federal delegation should really be hitting hard, and they should have been doing that for a long time, because
Just-
it continues
just
to, I
for
understand
us,
all that.
So for February,
Reimbursement's a
we'll like
mess.
look into that, cause if that does come up, and it'll probably come up in the vetting, I'm just starring that, cause that's something we need to answer.
Correct.
I mean,
Sorry.
I think there's, no doubt a problem. I don't wanna waste money. I don't wanna pay higher taxes. It is sort of a reality. But, the person that you talked about, Rep Burnham, who makes $46,000 a year, that is very likely the person who's not gonna be able to afford private long-term care. The people who are on pensions, that you're like, oh, why are we paying? We're paying to have pension employees. Seniors who have pensions are also likely to be the ones that can afford their retirement plans. They have a secure retirement. It's all the other people that don't have pensions that are gonna likely end up in the county nursing home.
But that's
And
not
I-
true.
That's not true.
My mother made less than that. Mother was on a very fixed income. She was a machine operator, okay? She didn't make a lot of money. But this is the thing. Other facilities accept Medicaid patients. They do. They accept that. They accept
For
that.
a certain number of.
And
they
where
take
is certain number two? We can't accept 1,000 people. Well, we can maybe, you gotta, we
Okay.
can't accept everybody.
You're
But just-
actually
just-
saying that these places right now, like, have you talked to any of these other homes? Have you talked to any private homes? In your study, have you talked to
Yes.
anybody? Okay, so have I. There's beds. There's beds.
But are they beds that they're gonna take? Are
Yes,
they gonna fill them up with
Correct.
Medicaid only?
some of them won't take,
providers?
maybe the very severe behavioral ones, if they don't have but they'll take others. They'll take true, like, no income Medicaid patients. Yes, they will.
Somebody's gonna throw something at me. I hate to interrupt you again, but we really are trying to go in an hour and a half thing, and we're gonna have these, I just wanna get through the bit, we've gotten at least
But
Kelly.
this is the whole thing. You had all this time to give your report and all of that. And instead, like, I thought this wasn't supposed to be like that, right?
I'm
I
not
thought
trying
this
to
was
be
just
like
supposed to
that.
be, what you're doing right now is right on. But this is what I'm saying. It's not supposed to be your program or your proposal against my proposal. It's not gonna be like that. Mine isn't my agenda. Literally, did you look at the numbers? The hard numbers. We are paying X and we are getting this. It's just like everything else in government right now. We are asking for everyone to spend more for less. Hi, here's your school budget. Instead of, we're gonna ask for
I'm
$4
gonna
more
call
million
point
dollars
for it.
for less
I'm
students.
sorry.
We're gonna ask for more money for less patients. It just doesn't mesh. It doesn't add up.
I get all of this, so I just structure, my brain works as like a regular municipal person. Again, I just wanna kind of keep the conversation moving and not bog down, which is the danger of this, because it's a highly charged emotional thing. We have at least a pretty solid framework at this point. Kelly has 3 ideas or 3 proposals, that we can throw on to the other proposals, so I consider that to be great. Cause that's exactly what I was hoping for when we come to the delegation. We have a background information. I work in housing and all you ever hear is how negative it is, you never hear any ideas, so I think we have at least a list of potential ideas that we can investigate. So I don't wanna bog down right now. We can have another meeting and talk more and give more time, but we're right now looking at, we're at 10:43 and we haven't even covered the financial thing, so can we just, and I don't mean to cut anybody off, just keep it going. Sorry.
Yeah, that's fine. I will, I wanna read 2 more things and then you guys, whatever, we can talk money. So I'm just gonna, if there was a phase down, if that was ever even adopted, right? So these are the guiding principles of it, and I thought this was, I read a lot of stuff about this, and I actually saw a case study, I think it was out of, was it Minnesota? It was incredible in how they did it. And so these are like the guiding principles for like the best way, for best care in mind for a county phase down. Or a nursing home closure. No displacement, no resident is moved without appropriate placement, family or guardian participation, and continuity of care safeguards. That's paramount. Resident choice first. Options include private skilled nursing facilities, assisted living when appropriate, or home with services when feasible. Transition now pathway. So residents who can safely transfer immediately to a private nursing homes are always prioritized. Admissions policy change. The county shifts immediately to kind of like this wind down admissions posture. Small renovations only. So even if, let's just say, the county says, over the next 5 years, this is what we're gonna look at. Inside that facility, the facility is actually going to increase because those, you're gonna focus on low cost and high impact quality of life, like improvements in those like occupied areas only. Like, let's make whatever we need, and no one's going anywhere. There's no displacement. Workforce stability. Staffing reductions occur through attrition, redeployment, and training, not sudden layoffs. We all know that if our amazing staff was available, now, that they would be scooped up by everybody in the area, because everyone's struggling for good employment. One of the nursing homes right now is spending, oh my gosh, she told me, what was it, the percentage. It was crazy, 1.5 times, or it was crazy over what they would normally pay a regular staff just in doing the travel nursing. It's insane and killing them. And we already know that that's going on in all of the hospital settings
Yeah.
all across the country, and especially in New Hampshire.
Yeah, I know.
It's
We know.
insane. Correct. So based upon, and then the whole like a transition team and office, and it's amazing. There's people that social workers in nursing, and you've got utilization, finance staff. There's like this kind of like what you would want to have like for an admission thing. Even if you're looking on an exit strategy. So it's insane how when you're doing this kind of work, like sometimes you think you would do that like in the get-go. Like if you did that, there would be in more collaboration with of course private and public just is huge. It seems as if there's more collaboration when something is happening of closure or whatever, then that collaboration should be happening right now. The collaboration should be happening right now. If you have a nursing home and you're 20 beds shy and all of that kind of stuff, and you're having problems with staff and this or whatever, everybody should be talking to each other in the county. And that's it's unbelievable that is not happening, and those silos should be broken down. Let me give my last thing I wanted to say. Is about the behavioral care. Because this is the elephant in the room, really. And okay. So for residents with significant behavioral health needs, the first step in any transition or phase down at all is comprehensive clinical audit. So in my report, which you guys, this summary, you're gonna see there's the last like page or page and a half on here is really important. These are some gaps. And this is what I'm gonna fill in, and this is gonna go into the main report. I will get some of the information from the county and some of the information, of course, just from the community. But it looks like a lot, but I wanted to explain where I'm gonna fill in these gaps. And one of the gaps specifically has to do with this behavioral piece, because I'm telling you, it's the most important thing with what our county needs to be focused on. Because I believe we've got 70 folks or so right now in RRH, and that's important. So for residents with significant behavioral health needs, the first step in any transition or phase down or capping or anything is a comprehensive clinical audit and individualized assessment of care needs. These residents, of course, often present with higher acuity and specialized requirements and must be carefully evaluated to determine the safest and most appropriate placement. People come first. To support this process, the county should immediately implement an admissions freeze for new behavioral unit placements in RRH until assessments are completed. That's going to be really important. You need to know what you're dealing with. We need to know the landscape. We need to know the landscape of Strafford County. We need to know outside of Strafford County as well, because we are definitely taking in behavioral patients from all different places in New Hampshire. And that's important, especially if there is going to be a new psych unit that's opening up and there's going to be other opportunities. We need to know what that landscape is. So until assessments are completed and appropriate receiving options are always confirmed during this period, clinical teams, they actually work alongside social work and case management staff. They should identify and document each other's resident specific behavior, psychiatric and support requirements. And so, of course, while many skilled nursing facilities provide some level of memory supported dementia care, not all have dedicated psychiatric or behavioral units. As such, identifying appropriate behavioral placements may require coordination with facilities that have dedicated behavioral units or enhanced clinical support capabilities, even if they can't take them. That's key. Once assessments are complete, the county should work with New Hampshire DHHS and the ombudsman, I never say that right, to ensure placements are clinically appropriate, preserve resident choice, and comply with regulatory requirements. Establishing early communication with nearby nursing facilities, including those with higher clinical capacity, can help identify potential placement partners while making clear that acceptance of transfers must be based on clinical fit and capacity rather than selective intake preferences. So I have, like I said, the report is about 24 pages long. You guys will have it, you'll have it, I would say, probably in full format. I was gonna have it on, so I called, let's just be all transparent, because I'm transparent. I called Representative Howland in a panic, because I actually thought that and he's laughing, I love him so much, because he laughed at me on the phone, and I'm literally, I'm like losing my mind, and because I thought that this whole entire presentation was gonna be done at the delegation meeting next week. And so I'm like, oh my God, I don't wanna release this yet, whatever. And so he's like, no, we're just, this is for the committee. And the plan is to have this report in March. So now that I have a little bit more time, I won't rush to have the final draft. I know you guys have yours in a Google Doc. I put mine in a Google Doc last night. I don't mind at all having it in a Google Doc for you to view. There's no secrets here at all. So I want to talk after this is all said and done about how we can do that collaboratively. I probably need maybe a few more days to see how long some of the gaps of information will take. And I know you need some information as well from the county too. And then, yeah, but this should be wrapped up, I mean, no more than the next week and a half, 2 weeks at the most. So, and my report at this point is about 95% complete, just waiting for some gaps in there. But I read yours. I appreciate all the work that you did. This isn't me against you and us against them. I'm so sick of all of that. I literally hate it in Concord, but we just have to be really looking at the hard data. And I know the landscape in New Hampshire is not good. I get it, but we really need to start thinking outside of the box, because I'm telling you, when people get those numbers, because it's gonna come out, and they see that they're paying per patient, and they make 50 grand, or their household income is 90 grand, and they're paying for one person, in one budget cycle, $230,000, they're gonna lose their mind. I mean,
They're
people
already
can't,
losing their mind.
exactly. They can't pay their energy bills, they
Can't
can't
pay it
put
now.
food on their table. I mean, it's really, really hard right now.
And I don't think that we
And
all appreciate who we're talking to. We're talking to people in this room right now that don't have a problem living day to day, that can pay their taxes. But I can tell you, up where I am, we have people losing their homes. They can't pay their taxes. The town and the county has to do something. We don't have a choice.
Well,
yeah,
we could say the state could do something instead of cutting
No, we're the community.
taxes. The state continues to pay less money, putting all the burden, these expenses.
Well, let's
on
get
the
rid of
local
government.
taxpayer,
I am
while
the-
giving-
I gotta call, as much as I really wanna go into like.
No, I want you to
details,
go into these
I
things.
just wanna keep
No,
going.
but I'm gonna give her that, because there has been a consistent, I know, like, it's okay. There has been a consistent, it's okay, Kaczynski. There has been a consistent shift down. We might disagree on policy, we're gonna disagree on that, right? But there has been a consistent shift down
No question.
that is just out of control. And that's what I mean. And that's ridiculous.
Money's going
So
to-
I'm not saying, that the state, whatever, but I didn't vote for it. So I didn't vote for that budget, and a couple people at this table did, and whatever. But that budget that went through spent from we're all in the State House in 2023, more than $1 billion more. Where is this money going? It's insane. Like, I don't get it. We spent more than $1 billion more than the last biennium, from 23 to what we passed in 25. And here
How
we
much of that
are.
was federal money?
Again,
Correct, I get it. So-
Honestly, I have to go like do another meeting, so
No, go. So, and let's let Representative Howland do.
I just wanted to run through the finance part, because I just wanted to give you guys more bad news. It's like, no, so it's like. So the financial part, you know, this is what always keeps me up at night. I think anybody who's ever tried to do a municipal capital project, you're struggling because you look at like the bonding cost, you're like, how on earth do we slide this into a budget without, you're talking about people losing their homes, about like spiking the tax rate. And it is really challenging, more challenging now than I think I've ever seen it, in 14 years.
I agree.
So, what we did is we ran 4, amortized, examples, just to give everybody a feel what a bond looks like. And I put on the graph here, I put your principal payment, your interest payment. Please keep in mind, the interest payment declines over time. So the overall payment will decline. So the total payments that I gave you in here is the biggest payment that it will be. All right, and I've given you then total principal, total interest, total cost of the bond. This is a 30-year fixed bond at 3.75%. All right, so the 4 examples we did, 75 million I threw out there, which was the true cost of the Sullivan County, even though they only bonded for 35 million. So a $75 million bond, the most expensive thing is, you're gonna slide a $5.3 million increase, or 5 point into the budget. A rule of thumb is for each $440,000 that you add, it adds 1% to the budget. So that means if you have no revenue offset, a $75 million bond essentially adds a little over 11% to the budget.
Wow.
$100 million bond, it's the total payment. Oh, and by the way, so the $75 million bond, the total cost of a $75 million bond over 30 years is $118,593,700. When you kick it up to 100 million, the yearly bond payment is 7 million. Total cost of the bond is 158 million. $125 million bond, the payment goes up to 8,854,000. Total cost of the bond is 197,656. And last but not least is $150 million bond, which the bond payment is 10,625,000. The total cost of the bond, and I'm sorry, I'm blasting through this quickly. The total cost of the bond is 237,187,000. Of course, when you do a bonding like this, the big question is, what revenue can you use to offset it? And we had a report that we did when we did the nursing home, and I don't know what the offsets are currently. So my question actually to Ray, which is like the uncertainty with changing Medicaid, is what offset could we theoretically have to bring down the cost of these bonds, and what would the true cost of the bond be? And then the second thing, just because I want to make everybody's life a little more difficult, would be if you ran the net yearly cost of those bonds through our current county apportionment formula, what would that mean for each town?
Yeah.
And so
Yep.
I know, okay, so I'm asking you to do a guess
Yes.
to do another guess.
That's
I just want to make sure everybody knows
Yeah.
that it's
Yeah.
not actually laid in stone, but I'm just trying to give everybody a sense of what the true cost of bonding is. I threw those 4 examples out there, but you could cut it down in any way you want to see what it would be like. And I think, yeah.
This was my favorite part of the report, because we get right down to the brass tacks of numbers and stuff. So I was wondering where, because I didn't ask you that on the phone, and I'd love the public to hear that if anybody's watching. Where did you get the percentage rate right now? Because that to me, the lowest that I have seen right now is like in the high 4s. So I mean, I really tried to get that. So What?
You have to, you gotta wait. You gotta wait. for
We
the-
contacted our.
Oh, I know, I
We
understand.
contacted our financial advisor and who sells bonds
Right.
from, the whole New England area.
And they were giving you a 3.75?
That's correct.
Yeah.
Okay.
But you're right.
But it's funny though,
No, it doesn't.
it's funny, it doesn't, that's not, he's telling you that like. at
Subject
that
to
moment,
change.
Right, yeah.
Subject to
Right.
change.
Cause they bid it out, that's how it works,
That's
right?
correct.
Yeah,
Yeah,
okay.
subject to change at any,
At any moment.
at any moment. If the Fed lowers the prime rate,
Yeah.
the rate goes down.
We would be happy if they lowered the prime rate, because it'd be in
Right.
our advantage.
You know,
That's right.
There's two things I think that needs to be said for the record, at least from my perspective. I agree 100% with Kelly's conclusions here. She's got 5 of them listed here. I think they need to be included in whatever report you come up with. I don't disagree with any of those things. Those are accurate. Second of all, there's no way. First of all, when we proposed the old nursing home, there were a number of financial things going on with all different types of things. We had money coming in from all sources. All those things don't exist anymore.
It's really sad. It's really, really
It
sad.
just doesn't exist anymore.
Oh, that's right, you're talking about what
Right.
was the revenue talk?
The revenue
Yeah.
offsets
Right,
are all.
Yeah, that's,
That's-
there's none of those anymore, right?
Right, that's all gone. So, most of it.
Well, that's all gone.
It's all, right.
Yeah.
So I want to be very clear with you, okay? If you were to construct a new facility, okay, you would have somewhere between a 15 and 20% tax increase for the next 30 years, okay? Roughly, for the
Not every year. You
No.
have it one year.
one year,
and
then it would
continue.
continue.
And it would continue,
Right,
yeah.
Right, but
So-
you wouldn't have a 20% increase every year.
Let me,
No,
right, right, that's right, it would be 15 to 20,
And then that would,
Then that
that would then become the base.
that would be the base.
And then we all moved to Kentucky.
No, hang on,
Yeah.
just let me
Just don't
finish,
staffing,
just let me finish if I may.
benefits.
Right, let me finish up. The original models that we're operating under, okay, were established 50 and 60 years ago. Okay? When at the time, Medicaid, in its instance, when it was developed, was 100% funded,
That's right.
okay?
We actually made a profit.
We made a profit, right? When I was first county commissioner, the Riverside actually made a profit, okay? All those dynamics have changed. So, unfortunately, they've changed, whether it's actions with Democratic administration, Republican administration, it didn't matter, okay? The model that we were all operating under 50 years ago, up until the last, 8 to 10 years, doesn't exist anymore. So, with that said, there is no way this board of commissioners, or any board of commissioners, would agree to a 15 to 20% increase in taxes and make that the new base going forward. It's unsustainable.
Mhm.
The model doesn't work, especially while the state ratchets down
That's right.
and pushes down those costs,
Right,
okay?
And the feds.
And the feds, both, because we don't know what's gonna happen with Medicaid. They're talking right now about passing that back to the states. Now, all this information you guys have got garnered here is
Can
all
you,
great
could you,
information.
cause I don't think a lot of people understand that. Based upon your perspective, we might have a different one. Can you
Right.
explain what that means, passing it back to the states, please, just quickly?
What?
What,
Yeah.
everything that I've read
Right.
Yep.
is that
A lot of people don't understand that.
I know.
the federal government is cutting back on their share of Medicaid. What they haven't said or haven't distributed is what, Medicaid is a vast, vast program.
Right.
We're just looking at the
One-
long-term care.
That's right.
And the, I won't say elderly piece because a lot of younger people need long-term care. What the federal government hasn't said is where that Medicaid money is going to come from. What
Right.
pocket of money is that gonna come from? So therefore, the state really can't make any plans because they don't know what money they're not gonna get.
Yeah, right.
And where the impact is going to be. So, that's why the very first meeting, and for those of you that might or might not remember, I said from the very beginning that all of those assumptions that we put forward
regarding the report from Lori Stribinette are off the table.
That's correct.
They're gone.
They're gone.
You know, we had that opportunity and we didn't take that opportunity
Ship sailed.
and now it's gone. So I wanna reiterate that. I'm not, it's not gonna be my legacy here as I leave to pass on or to recommend some large tax
Or
increase.
mine.
It's just not gonna be. And I don't have that much longer here. And that's not the way I wanna be remembered.
Is this your resignation? No, I'm just kidding.
No, I mean,
No, but it's not far away.
I mean, again, the only reason I put this out there, it's not just the nursing home. I mean, again, like when we're doing, figuring out zoning to do housing in this, we're all running into this right now. It's a changed economic model that we're
Right.
facing.
That's correct.
And so that is the reason that we're doing this.
And that's why all these things need to be included in there, because the
Yeah.
model isn't the same. It's just not the same. It's no different than what we did with the jail. And I want to remind some of you older legislators who were here at the time, 25 years ago. When we went to build a new addition on the jail, it was the third addition we went to build. Okay? Since I was here. And we went to build the third edition and the delegation says, we're not gonna build the third edition, you gotta come up with something else. Right? The model of the way we handle corrections had to change, had to shift to a new model. Today, we're operating that new model. That new model produced $100 million in revenue for this county, right? Everybody told Ray and I that we were crazy, but we weren't crazy. I said, have some faith. I remember having that conversation with you, Janet, when I said, we're gonna build a jail, it's gonna be more expensive, but we're gonna be able to save money long-term and create revenue. Okay? And I said, have some faith in what we're talking about. What happened when the model shifted? So today we're watching 600 people in the community instead of having to house them in county jails, okay? The model that we have in our state, under our state Medicaid plan right now, has to change.
It does.
It has to change, okay? The model the assumptions that we were making, the time when we proposed the nursing home, all those assumptions went out the window in the changes of administration and the way they want to administer Medicare and Medicaid. I don't disagree with anything that you said. I don't disagree with anything, okay? We have to look at a new way of doing business, okay? The question is how, and can we leverage some form of nonprofit or private investment, okay, to help us out with this? I don't disagree with any of that, okay? I think that's the path that we should take, because the model that Ray and I worked with for 40 years is out the window. It's gone, okay?
Yeah.
And I'm not gonna sit here, I would never come back in here and propose another brand new nursing home with a 20% increase in taxes. I personally would never do that, and I know my colleagues would. And I know you wouldn't vote for it.
I
So,
agree with you.
so.
I agree with you.
So,
Say this 6 months ago when I first got here, because you've been.
Well,
pushing this.
regardless, I, it
agree
doesn't
with
matter.
you.
We are here.
I
know,
know.
we've been
I
waiting.
think we need to,
Yeah, because
it's
we
been 2 hours.
Right,
I think we need to continue this discussion.
right.
Soon.
Yeah.
I left my phone at home, so I'm on my calendar, but
Yeah, so
Should
because
we-
we're crazy busy in the state house,
Yeah.
are we gonna, I think that, I mean, my best day is still Friday. Is that really kind of fall for everybody?
Yeah.
Like my committee?
No alternative.
Okay, so,
You want all alternatives on the table, okay? I mean, that's the idea here, that's the
with
plan,
that,
to put all alternatives on the
Yeah.
table.
so we're.
Okay, then,
we're out there.
then I'm gonna spend time with my colleagues coming up with some other alternatives. Okay? That we can support without killing the taxpayer, okay? And try to come up with some plan with a new model. Different from the old model, you gotta understand one thing, the old model wasn't a bad model. It just, Medicaid was funded at 100%. We've seen this erosion go on with it passed down to us. Remember, no matter what you come up with, I don't care if it's private sector, not private, I don't care what you come up with. The state law still says the county has to pay for it.
Consider
Okay? You have to remember that.
That's a reality.
That's the real, the state law says the county has to pay for it.
No,
Now,
that isn't, that's the
you
problem.
folks can change
We can
that law.
change that.
You can change that law and get the state to pay its own bills, but right now, and that's the way it's been for 60
I'm gonna say
years.
something.
All right,
I wanna say something on record before we end. So let's just think about this, right? So we have lottery, with the gambling, we have all of
Yeah.
that. And all of that money
Those are-
literally goes to children.
Yeah, education.
So why aren't we taking a slice of that for our
There you go.
seniors?
All for
Okay? We literally, in that education trust fund for years, had hundreds of millions of dollars in there that were just sitting. And I know we're not gonna get into education discussion, that money's been moved over into general fund and all that kind of stuff. But let's be clear, that's the legislature that can change that, to say, you know what? Why don't we help our seniors here in New Hampshire? Let's talk about that. That's a great bipartisan thing that we should be doing.
Take a look at the revolving funds like.
Hey, I mean, we are the house.
We
We're,
need to wrap
we're
it up.
the county, but we're the house too, in the aggregate. And that money's get, all those responsibilities are shifted down to the county.
No way, we're
Every
gonna really do it on
damn
February
year.
13th? Oh, let's do it.
We can.
Let's dress up.
Nine.
Dress up.
I don't think they-
Kaczynski, I'm gonna get you like some little fake blood coming out of your ears. or-
Yeah.
Just wait, it's coming out naturally.
That was good. He just gave you a little dig. That was good. Did you hear that?
My friend Pete.